1.
Good afternoon from Rabat and good morning from Washington, D.C. My name is Hindin, and I'm a senior fellow at the Policy Center for the New South. Today, I'm very pleased to participate in this exciting webinar on the response of international and regional financial institutions to COVID-19. As we all know, COVID-19 has created a tremendous impact, causing huge human losses, restriction of freedom, lockdown, and an unprecedented amount of fiscal spending. In the medium term, it's changing the behavior of many agents in the economy, for instance, in the labor market. And in the longer term, it has adverse impact on the human capital development. Our discussion today focuses on four main themes. And although the crisis affects all countries alike, we will pay special attention to the developing countries, mainly because they have limited capability to deal with the impact. The four areas that we will discuss today are, first, what are the international and regional financial institutions? What have they done to help developing countries cope with COVID-19? Second question is, do they have a strategy to support and finance the economic recovery? The third is, how can we accelerate their fair access to COVID vaccines and the treatment to support the South recovery? Finally, we will discuss the role that international institutions play to lay the groundwork for an inclusive and sustainable economic growth. Is there any new missions or changing role that is foreseen for these organizations? So we're very fortunate today to have three very distinguished speakers, and they are among the most authoritative speakers on this subject. Their bios have already been listed throughout the brochure. And so in the interest of time, I will briefly mention the name before inviting them to speak. The first speaker today is Professor Riem Ayadi, who is the president of the Euro-Mediterranean Economists Association. Professor Ayadi teaches at Cass Business School in London and is a member of many organizations related to financial and banking research throughout the world and in Europe in particular. Her fields of expertise include sustainable economic model, international financial systems, financial markets, and institutions, among others. The second speaker is a very well-known economist, Dr. Prakash Longani, who is a senior manager at the IMF and is a senior fellow at the Policy Center. Dr. Longani is also an adjunct professor at Johns Hopkins University and professor of management at Vanderbilt University. And he has published in top-notch journals in macroeconomics, including labor market policies and unemployment. The third speaker is Dr. Emmanuel Pinto Moreira, who is the director of the economics department of the African Development Bank and also a senior fellow at the Policy Center. Dr. Pinto Moreira has worked at the IMF, at the World Bank, and at the African Development Bank, and has published widely in the areas of growth policy, trade and competitiveness, public financial management, and exchange rate policies. So without further ado, let me ask Professor Ayadi to begin. Please, Professor Ayadi.
Thank you very much, Hin, for the introduction. And I would like to thank the Policy Center for the New South for organizing this important webinar and then for inviting me. I want to start my comments by highlighting that the COVID-19 pandemic is not over yet. So we're still seeing some waves. Of course, those waves are not as, I would say, dangerous as they were at the beginning 2 years ago, but still we're not over yet from this pandemic. Also, we've seen that many countries have stepped up their effort to vaccinate, despite we still see an equal distribution of the vaccines between high, middle, and low-income countries for many reasons. And I'm not going to delve into this webinar because there are extremely many reasons in terms of the infrastructure, for example, of distribution in low and middle income countries and other type of resistances, which made that some countries could not access the vaccination as others. Adding to this, the war in Ukraine that is having actually substantial economic implications in terms of the energy, food poverty, while also having to accelerate the green transition to comply with the Paris Agreement targets. These all are costs that all these countries will have to deal with in their budget. And also it's clearly was clear with the war in Ukraine that many countries will have to lift their dependence into polluting fossil fuel. And this is, for example, if we look at what is happening in Europe, it has shown to the world that green transition is essential and it needs to go as accelerated as possible. Now, countries qualified that are middle and low income, which are the target of this discussion today, clearly are expecting to continue borrowing and pushing debt levels globally higher. So it doesn't mean that they will stop. It means that the stock will increase and the flow of debt will increase, of course, to alleviate the social cost of the pandemic. So they still have to deal with it. But also on the top of this, they have to deal with the social and economic challenges brought about by the war in Ukraine because of the increasing prices of energy, of food, and also the tensions that we are seeing currently. But there is another issue that we need to think of, that we thought that we are resuming the recovery phase post-COVID, but in reality, with this war, this recovery phase most probably will have to be delayed and even completely rethought. Now, we are seeing, for example, in many countries, inflation is going up very fast. There is low growth prospects because simply the investments is subduing. And this will not help the recovery at all and will even most probably drive certain countries, and we know them already, there are many countries that are touching the default scenario. Now, of course, I don't see there is a comprehensive global resolution framework. So which, in fact, if there is a systemic debt crisis, pushed also by food and energy crisis, we don't see how all of this will be resolved orderly, particularly for the low and middle income countries. Obviously, the cost for those countries will be extremely high, especially if they will have to restructure or default on their debt. And obviously having to deal with political, economic, and social instabilities, and will drive into social unrest and even further into further conflicts and other ramifications that we might see down the road. So I'm not going to debate about what the research shows in terms of having this disorderly restructuring, because we need now to move into preventive type of restructuring where everybody has to collaborate, not only the public sector, not only international financial organizations, but also the private sector. And this I have said even before the COVID-19, I mean, when dealing with the COVID-19, but now with the Ukraine war and all these consequences that we're seeing, these efforts will have to be even further stepped up. Now, I see, of course, and I welcome very much the role of the international financial organizations over their role in the to respond to the COVID-19 pandemic. So I'm mentioning the G20, the IMF, the World Bank, and other regional organizations like the African Development Bank, Asian Development Bank, and Also, the EU and its multilateral institutional frameworks. But then again, today we are still responding to the COVID-19 recovery, not to the Ukraine war that we are living today. And we could see clearly that many countries in, for example, Africa, Middle East, are suffering very much in terms of the energy crisis and the food crisis. But no, I'm speaking mainly about the countries that are importing gas and oil. So this is, but the others, of course, they are still reinforcing, I would say, the polluting type of fossil fuel energy sources. And these are most probably will have to be lifted if we want to move forward with the Paris Agreement target. So these are all, in my view, transition period. So my view on this is the costs for all those countries, particularly in the low and middle income countries, will be very high. And I'm asking my fellow panelists, who is going to pay for this at last? I know that there has been a lot of discussions about stepping up the efforts by the IMF and other organizations, for example, in terms of the poverty reduction and the growth trust, and also this newly created resilience and sustainability trust that would eventually channel the SDR to some countries in Africa and others. But again, is it a partial solution still? And we still need to use this to leverage, to attract private sector to contribute decisively to the recovery beyond COVID-19 and also beyond, hopefully, the Ukraine war. And at the same time, eventually try to decentralize the use of those, I would call them recycled SDRs and all of this. But this is all under discussion. But unfortunately, we hear, for example, lately from the US Congress, that was a decision to withhold the SDR channeling. So what will mean this in practice for the low and middle income countries? This is something we need to discuss it further. Now, my view is to, for the G20 also, since the meetings are happening in Indonesia, is to step up the effort and to really bring the private sector on the discussion table, to participate into a decisive collaborative recovery process via really using what is possible to use from the SDR and also other resources from the European Union under their multi-annual financial framework, and then try to attract the private sector to help, or I would say to support the global recovery, because now we need really to have a process for global recovery, which in my view is essential not to bring the global economy on its knees. And this is what everybody wants to avoid in the next years. That's all. Thank you.
Well, thank you very much, Professor Ayadi. Anybody who wants to comment quickly on Professor Ayadi's presentation? If not, we move to Dr. Longani's presentation. We can come back, but since Professor Ayadi is leaving in about an hour, if there's any questions, very quick questions on Professor Ayadi's presentation, we could quickly discuss it now for another 5 minutes before Dr. Longani starts. Otherwise, we move to Dr. Longani then. Yeah.
Okay, thanks very much, Hin. And thanks to the Policy Center for organizing this webinar. Actually, if I may, could I ask Rim a couple of questions from?
Excellent, yes, please.
Yeah. One thing I wanted to ask you about, since you're familiar with the situation in these countries, is about sort of vaccine hesitancy in developing countries. Do you think that in addition to the kinds of factors that you mentioned, namely unequal distribution, not having the right networks and so on, is it correct to say that there is a fair bit of vaccine hesitancy also in these countries?
Absolutely. We have done some research, and it's clear that there are some cultural aspects linked to the vaccination because of the possibly the the lack also of information on certain vaccines. So then probably many people, they prefer not to get the vaccine. So that's number one. Number two, we also observed that there is still a problem with the testing, and there is a correlation between testing and vaccination. Since testing is not very much reliable, and it is not generalized, and it's also quite expensive if you compare to the average minimum wage in those countries. So there is no testing. So the testing is not really generalized. So there is no information about the magnitude of the infections. So practically, not knowing whether people are asymptomatic, especially when they are asymptomatic and then they go for a vaccine, then there is a problem there which we might not know. So these are all factors which, in my view, should have been looked at previously before really assessing, the scale and the generalization of the vaccine in those countries.
Yeah.
My other question, quick. Yeah, go ahead, please.
Very, very quickly, Prakash, on the questions of vaccines, I think it's going to take quite a while longer to really get any sort of herd immunity in the developing world, mainly because of the restrictions regarding the delivery mode of the vaccines. For instance, for Pfizer, you need to have storage of minus 132 to 76 degree Fahrenheit to deliver. Now, if you're in Kinshasa or Bujumbura, it's going to be very, very difficult. It's going to take a while longer to get the energy resources to help deliver these things, besides the skill of the nurses. So,
right.
Go ahead, Prakash.
Yeah, no, my other question quickly, if I may, is about the growth prospects for these countries, Rim. I sense, I agree that there's a lot of room for pessimism about it, but has the pandemic shown also some rooms for optimism in the sense of accelerating a more, accelerating the transition to a more digital economy, more service-based economy? Is there some room for optimism?
In some countries, probably. For example, on an assessment for certain countries in the South Mediterranean, Egypt has managed to keep a positive growth rate. Obviously, this is also linked to the fact that they have not responded to the pandemic with very harsh lockdown. Mm-hmm. Of course, there is a connection between the rigidity of the lockdown and the overall growth past and possibly future.
Right.
Now, with the war in Ukraine, this most probably will have put a huge constraint on these countries as well, particularly the ones that are importing food or mainly basic, I would say, crops like wheat. And as we know very well that the wheat the price of wheat has increased dramatically, and this will put further pressures on countries, for example, like Tunisia, like Egypt, like other Jordan, and all the countries who are consuming of wheat. Same in terms of energy prices, especially the countries that are importing. So, in my opinion, when you have much higher inflation, and then the growth rate is not as high as it should be, so it needs to be much higher as anticipated before. So there is huge risk for these countries to resume recovery. And I think we also need to consider something. I want to back to one point I wanted to add back to the vaccine. These countries, they did not get all the vaccines from Pfizer and Moderna. Also, this is or AstraZeneca. They also had vaccines from Russia, from China, from other providers. And this is also creates a kind of diversity from one point of view, but then from one perspective, but then on the other hand, and especially if they cannot choose, the people cannot choose the vaccine, so they resist once and for all, and just they don't get the vaccine. That's another comment that we made also in the study we have. I have shared with you.
Okay, thanks very much. If I can now go to my presentation.
Please go ahead.
Okay, so what I will do is to focus on the IMF's response to the pandemic. And I will focus on 2 of the 4 questions that were posed to the panelists. The first is what was the response from various international financial and regional institutions. So here I'll focus on what the IMF has done to help countries cope with the pandemic, of course, not covering all aspects, and focusing mostly on what they did in the first year. And second, what has the IMF done to lay the ground for an inclusive recovery? I can also talk a little bit about the sustainability efforts of the IMF. So I'm not trying to assess IMF efforts at this point, mostly offering a description and some reactions. Separately, I'm leading an evaluation of the IMF's response to the pandemic. So I would not want to front run that investigation. So this is some preliminary thoughts. So I'll focus on 3 features of the IMF's response. First, the overall strategy, which was to make quick use of the IMF's emergency financing loans rather than the more standard loans that the IMF gives. The second was the very quick revision of the global and country outlook. Many in the world sort of rely on and look to the IMF's forecasts to form their judgment of what's going on and to calibrate their actions. So what the IMF says about the outlook is always pretty important. And third, I'll focus on the IMF's fiscal policy advice, which has been characterized by many as being a bold stance and breaking with the past traditions at the IMF. So let me start with IMF efforts during the pandemic. The first thing to be aware of is that the IMF acted extremely quickly. So by March of 2020, it had already given loans to 5 countries. And in April, it gave loans to 45 countries more. So that is what you're looking at in this chart. The numbers are the number of countries that received financing. And the colors you don't have to pay too much attention to, but blue and orange are the emergency financing. So you can see that in April 2020, which is the second bar from the left, almost all the financing was in the form of emergency financing. So this is the first aspect, is that IMF support was extremely timely. By March, April, May, June, you can see that many countries had received financing. So if you add up those countries, almost 100 countries had received some form of financing within the first 3 or 4 months. The second feature is that IMF loans are always in the public mind and in the mind of country officials associated with conditionality. The IMF is always asking for something that the countries have to do in return for the loan. But this being emergency financing, there was very limited conditionality. Now, was this a good strategy for the IMF to do, namely rush money out the door quickly in response to a humanitarian crisis, a health emergency? There are actually, two sort of classes of views on this. One view is that the IMF may have provided too much financing on too easy terms. Some of the countries receiving the money were countries where, as Rim was already mentioning, where the debt situation was already quite distressed. So here is the IMF making a loan to a country that is already in debt distress. So it's taking on some risks to its own balance sheet. It could also be that by providing easy access to emergency financing, the IMF crowded out its standard loans. So it could have been that the countries may have come for standard IMF loans, which would have given the IMF greater control over how the money was spent, what countries needed to do in response. Maybe that was crowded out. And then the third concern by people expressing this view is that, this was emergency financing given without much conditionality, rushed out quickly. So making sure that there were anti-corruption safeguards, making sure that the money was going to the right people, to the right places, and not ending up in the wrong pockets was difficult to ensure. So there are people who are kind of taking this view. The IMF's former chief economist, Ken Rogoff, who always takes provocative views and writes provocatively, recently wondered if the IMF had become an aid agency rather than an agency that makes loans. On the other side, there are people who said, well, did the IMF really do enough given the scale of the crisis? And was it able to tailor its financing to what was actually needed by the country? So people on this side, and there are several people, including some authors at the think tank in DC called CGD, Center for Global Development, some of them sort of take this kind of view that the financing, particularly to the low-income countries, was actually not that high relative to perhaps the needs of these countries. And this group also emphasizes that perhaps there could have been more and better coordination with the World Bank and other partners, also a theme that was just stressed by Rim in her remarks, that, in a sense, we need a kind of coherent collective response from the official sector to really be effective. And the third point is, again, something she made, which is that you don't need just an effective official response, but it has to be a response that is able to catalyze flows and responses from the private sector as well. So these are two views on the IMF strategy. I should say that I think the IMF response has generally been praised for living up to the occasion and being timely. So these are reflections with hindsight and aim to think about how international and regional institutions could perform better in the future and, in fact, perform better in the face of this new ongoing crisis coming from the war in Ukraine. And just to continue on this theme of how the collection of official sector agencies has performed, in this audience, people know that there is something called a global financial safety net, namely the financing and support provided by all the financial official institutions together. And Kevin Gallagher, a well-known commentator on the role of international financial institutions, has a new paper saying that the global financial safety net remains very patchy. It's like Swiss cheese. It's not really protecting people. Countries kind of fall through the holes in the global financial safety net. But his paper also raises some interesting questions about how we should think about it. Our normal approach when we think about financial sector, official sector institutions is to say that they should coordinate. They are all government bodies, official sector bodies. They should be coordinated, and they should together be helping countries weather whatever crisis it is. But his paper, not as his own personal view, but as a view, raises the possibility that you also need some choice and competition in the system, because that gives the countries some bargaining power. It allows them to ensure that there is better delivery of what they are supposed to be getting from the official sector. Okay. So I throw that out as a possibility that I think my sense is on this panel, most of us would be in the camp of arguing for a coordinated response, but it's worth remembering that if the institutions are not effective, if they are prone to failure, then just bringing them together is not necessarily going to make the total more effective. It could be that a way to discipline official sector institutions is to have this kind of choice and competition. So when it comes to the role of the IMF and the World Bank in this pandemic, I think our natural instinct would be to say the IMF and the bank should be working together to provide help to the countries. And I think that is the right response, but we should keep in mind the possibility of institutional failure. Okay. Let me turn quickly to the IMF's growth forecasts. These charts may be difficult to read. Basically, they're showing you how the IMF's forecasts compare to those of the private sector and how they compare to those of the World Bank. The main story that emerges is that the IMF this time was somewhat more pessimistic about what the growth outcomes would be than the other sources of forecasts. So again, I won't talk you through the detail, but this is giving you the forecast for the world as a whole, for advanced economies, for emerging markets, and for low-income countries. And the consistent message that emerges is that the IMF's forecasts, which are shown by the blue dots, you can see are below those of the other sources. And this emerges very clearly when you, instead of looking at all the countries aggregate, you focus on the top 10 countries in terms of their weight in the global forecast. So those 10 countries are shown in this chart, and what you are shown here is what is the IMF's forecast error compared to the errors made by the private sector. And what you see here is that the IMF was consistently more pessimistic. So one example is Brazil. For Brazil, you see the IMF's forecast error shown in blue. You see the private sector forecast error shown in, I guess, orange. And you can see that the error, the blue bar is much bigger than the orange bar, showing that the IMF was more pessimistic and much more so than the private sector. Same pattern for United States, China, Russia, France, etc. Okay. So this was a kind of a new finding that we have uncovered in going through the IMF's forecast is that this time the IMF was much more pessimistic about what might happen to the economies during the first year of the pandemic than other sources. And this may have influenced the kind of policy advice that the IMF was giving. So that brings me to the third and last part of my talk, which is what has the IMF been doing to try to promote an inclusive recovery. I would say that the main focus of the IMF has been in trying to calibrate its advice on fiscal policies in order to make sure that not only does the economy recover in an aggregate sense, but that low-income, low-skilled, vulnerable people also share in that recovery. So as soon as the pandemic almost was hit, when the IMF issued its flagship publication called the Fiscal Monitor in April 2020, it immediately said that fiscal policies have to be at the forefront of responding to the pandemic. It said fiscal measures can save lives, protect the most affected people, etc. And it said large, temporary, and targeted support is urgently needed. And if you contrast the IMF's view in October 2020, by which time things had improved somewhat compared to the dire forecast and situations in March and April, the IMF still urged that fiscal support be maintained. So the Fiscal Monitor in October 2020 says, we emphasize the importance of not pulling the plug of fiscal support too soon, which was the view also being taken by prominent economists at the time, like Larry Summers, along with Jason Furman. He said pretty much the same words. The primary worry for policy in advanced economies in their case, but in the case of the IMF, the advice was for all countries to the extent that they had space. It was very consistent with what Summers and Furman were saying, is that the primary worry for policy is doing too little to expand the debt, not doing too much. And clearly this was perceived by prominent commentators in the media as being a break from the perceptions of IMF advice in the past. The IMF advice is generally referred to as austerity advice. IMF is said to always advocate austerity no matter what the situation. But here you can see both the Guardian and the Financial Times, UK papers that don't often agree on much, both agreed that the IMF was saying in one case, austerity is not inevitable. According to the Guardian, Financial Times had pretty much the same headline. IMF says austerity is not inevitable. Okay. And the IMF has, again, emphasized the impact of premature withdrawal of fiscal support on the poor, on the low education part of the population, on the low skilled part of the population. So it has advocated somewhat more progressive actions like higher taxes for more affluent and highly profitable firms. Now, I said that this had been regarded by many as a break with the past, but in civil society, there remains some skepticism. So for instance, Oxfam last year still continued to characterize the IMF's advice as being austerity driven. Okay. So let me conclude at this point with saying, just repeating the points I wish to make. What I wanted to say is that this was a crisis like no other, and it appears to have prompted an IMF response like no other, in the sense that the IMF came very quickly to the support, to the aid of countries. It provided money, loans in the form of emergency financing. It provided those quickly with very few conditions. And this support has generally been appreciated by the countries. It's been appreciated by the international community. But nevertheless, as I said, in terms of thinking about how the IMF should go about in future crises, which unfortunately have just erupted with the war in Ukraine as something that's going on right now, there nevertheless are questions about, is this the right strategy? Is this too much money on too easy terms? Is this too little and not targeted enough? So there continue to be that debate. And then in terms of what the IMF has done to promote an inclusive recovery, I have focused on the IMF's advice on fiscal policy, which I think is the critical element in, at least in far as the IMF can influence things, in ensuring that the lower deciles of income within our society, people in the lowest deciles of income in our societies, also start to see a recovery, not just the people at the top. So let me stop here. Let me stop sharing.
Thank you, Prakash, for a very enlightening presentation. Rem, before you leave in the next 15 minutes, if you have any questions to Prakash, please raise it now, or else we move on to Emmanuel's presentation, please.
I just have probably one comment about the conditionality and the austerity. For sure, the business as usual scenario for the IMF when they discipline the fiscal position or fiscal sustainability of certain countries needs to be revisited for this exceptional circumstance. We are living in a compounded type of crisis generated by external factors, particularly for those countries. And at the same time, we are moving into transitions, digital transition, and then green transition. And these are all transitions that are very costly, but then we need to go forward with them to meet the Paris target. I do not know, sometimes I've been thinking whether the IMF and other financial institutions should also be inscribed into this type of forward thinking rather than thinking solely about fiscal discipline, debt sustainability, and austerity measures. I don't know whether you have had this discussion internally to rethink based on the long-term challenges that I mentioned.
Yeah, no, I think I did not emphasize in my presentation, but I'm happy to do so now, which is that the IMF clearly is trying to make a major effort right now in trying to bring about a sustainable recovery and in trying to bring about a transition, kind of an energy transition. So the present managing director is known for her advocacy of the IMFs playing a big role in advising countries on how to cope with climate change. So I think it has been reported and is well known that she would like to have a major investment at the IMF in terms of hiring several additional economists who are devoted to understanding the climate change challenges that countries face. So I think it's quite important to acknowledge that she has made that kind of one of the cornerstones of what she would like to do. Now, how successful she is, how effective that strategy is, remains to be seen. But there's no doubt that from her perspective, she clearly wants a green recovery, not just a recovery. So it's, I think those efforts are definitely something to recognize. And I think it's be very useful if Rim, you and other experts could sort of see what that strategy looks like, the IMF's climate strategy, and try to offer some comments before it goes down a track that has already been laid out. I think right now there is still room for concerned people like you to influence that strategy.
Excellent. Emmanuel, do you want to?
Yes. Thank you very much, Hin. Thank you, Prakash and Professor Rim. Let me just say that I will be kind of saying three things. First of all, give a kind of little bit of background on COVID-19 impact on Africa. And second, how the African Development Bank actually responded to the crisis. And third, what the African Development Bank is doing now, in particular, what is the focus to address issue of financial risk, but also to help the countries cope with the high debt, in particular since 2010, the debt increased a lot. So my first point on the background to say that, well, if you look at COVID-19, COVID-19 actually hit a lot the global economy. The global economy lost something like $4 trillion in 2020. And if you compare $4 trillion, it's more or less something like 19% of United States nominal GDP, which is about 21 trillion. Or it is about 22% of European Union nominal GDP, which is about 18 trillion, or 15, or something like 26% of China nominal GDP, which is about 15 trillion. Or you can also say, well, 4 trillion is almost the whole African continent nominal GDP, which is about 3 trillion, 3 to 3.6 trillion. So a big shock on the world economy, and it hit severely African countries. If you look at the figures, for instance, you see that COVID-19 resulted in actually the recession in Africa. For the first time in 50 years, Africa went into recession with a real GDP growth of minus 1.5% compared to 2019, where the continent still had a positive growth rate of 3.3%. And all the Africa region, mean West, Central, North, all of them actually went into recession. The only part of Africa who still had a positive growth rate was East Africa, and it was 0.7% compared to 5.3% in 2019. Why? Because we have countries which are non-resource intensive countries like Kenya, Rwanda, Ethiopia. Keep in mind that Ethiopia, even during the crisis, still had a positive growth rate of 6% in 2020. Southern Africa actually recorded the worst recession in Africa, with a real GDP growth rate of something like minus 7%. Countries such as South Africa in 2020 had a negative growth rate of minus 8%, even Botswana, minus 9%. So basically, it was a huge impact between deficit, the fiscal deficit, current account deficit, a lot of debt issue. And the worst thing is that COVID-19 actually pushed up to something like 40 million Africans into extreme poverty. So this is a picture of a big shock for the global economy, but also mainly for African countries. So what did the international community did, in particular the international financial institution? Prakash already talked about what the IMF actually did. What the World Bank also actually came up with a package of 160 billion to support actually developing countries. And in this 160 billion, 50 billion was actually allocated to Africa. For the African Development Bank, we actually acted very quickly. In April 2020, African Development Bank put in place the COVID Rapid Response Facility, COVID-19 Rapid Response Facility, to support regional country members. But it was not a big money. You know that the African Development Bank is not like the World Bank, right? So we came up with an envelope of $10 billion US dollars to help with $5.8 billion for sovereign operation, $3.3 billion for ADF country, African Development countries, is like what we call at the World Bank IDA countries, right? To have a parallel. And this COVID response facility actually was focused mainly on three sectors. The first one was, of course, the health sector. The second one, social protection. And the third was actually on business. For the health sector, there was a lot of resources which was actually provided through actually budget support operation to go fast, to go quick, to help. And there is actually a quick report, a preliminary report on what was the impact of that money that we actually allocated very quickly to budget support to all the Africa members countries, all the 54 African countries receive actually, in particular for the fragile states like Burkina Faso, like Mali, like Central African Republic, the DRC. So the bank actually reacted very quickly to give them budget support. So what the preliminary results are actually giving is the following. In the health sector, for instance, the preliminary result, which is, Prakash, what you mentioned, kind of, in the bank, we call it actually IEG, which do a kind of, at the World Bank, we call it IEG, which do actually a kind of, let's say, an assessment of how the resources are used, and the same thing that you guys did, you guys actually do at the IMF. So that report from that department showed that, for instance, the testing capacity for regional member countries, and I'm saying that because Professor Rim is there and she can actually give more detail. It shows that the testing capacity for regional member countries, so the 54 African countries, actually increased from 15,000 daily to about 180,000 daily. Same thing, there was actually 130,000 healthcare workers who have been trained to how to test and help the population to avoid getting COVID-19. The second was in social protection. The report actually shows, and I'm taking off a quick example. The other report showed that the number of vulnerable households who actually benefited from support from the African Development Bank actually increased from 9 million to about 29 million. Same thing for the business protection to kind of avoid that small enterprises actually close down. About 300,000 small and medium-term enterprises actually benefited from support from the COVID-19 response facility. But the bank actually understood that really we have a lot of challenge. The challenge is that we don't have enough resources, right? As I said, it was just 10 billion US dollars. With 10 billion US dollars, you cannot really address the impact of such a crisis, which is a big magnitude. That's why the bank is more focusing today on how to kind of help those countries build system in terms of capacity, how we can help them increase their technical capacity, how we can strengthen. In particular, the bank is focusing on this issue of debt because the debt situation is becoming really worrisome. As you know, in the 2000, we had this heavily indebted poor country initiative, which actually, and the MBRI, the Mutual Debt Relief Initiative, which helped a lot of African countries for actually recover from the debt that they have. But since 2010, there is a second wave of debt in Africa. The debt is increasing a lot. For instance, in North Africa, just between 2019 and 2020, the debt to GDP ratio increased by something like more than 12 percentage points, which is a lot. In Sub-Saharan Africa, by more than 6 percentage points of GDP. And the bank, the African Development Bank, estimate that the debt to GDP ratio for the whole continent today is about 70% of GDP, right? Which is a lot for those countries. But what is really worrisome is the fact that the structure of the debt has completely changed, right? In the context of the HIPIC, right, and the MDRI, most of the debt was actually owed to multilateral development institutions like the World Bank, the IMF, or bilateral creditor members of the Paris Club. But today is no longer the situation. Most of the debt is owed to non-bilateral creditors like China, something like 13% of African debt, plus the fact that most of the debt, the commercial debt is not really high. It's something like 40% of the total debt. And many African countries actually went to the market to issue bonds, and many are in very difficult situation of debt sustainability because many of them actually were downgraded by the Fitch, Standard and Poor and so forth. So we also know that the international community came up with this so-called DSSI, the Debt Service Suspension Initiative, right? But also with the so-called general common framework, the G20 common framework. But the bank position is to say, well, the DSSI is good, the common framework is good, but these are actually temporary solutions to address a more structural issue, the issue of the debt, because it comes from the fact that many African countries are having issue of fiscal deficit, and also the fact that some of them, even in terms of the policy, use a kind of pro-cyclical fiscal policy when, let's say, the commodity price increase, when we had this super cycle of commodity price in many African countries like Gabon, Equatorial Guinea, all these oil exporting countries actually went into debt. They use a pro-cyclical fiscal policy and they borrow a lot. See? So the bank is actually reflecting on a permanent mechanism to address the issue of debt. This is where the idea of the Africa Financial Stability Mechanism actually is coming from. Keep in mind that this is a kind of regional financial safety net that the bank is putting in place to address the issue of debt permanently. This kind of mechanism, I might say, already exists, right, around the world. For instance, we have the Arab Monetary Fund, which was created in 1976. We have the BRICS Contingent Reserve Fund, Brazil, Russia, India, China, South Africa. Or we also have the European Stability Mechanism, right, which was created during the 2008-2009 crisis, right? So what is happening is that the bank is trying to put in place this regional financial safety net to help not only address the debt issue in terms of providing resources very quickly to those countries. So that will be the first objective, but also in particular to prevent this debt situation to occur in the first place. And this is the second objective, so crisis prevention mechanism. Now the bank is also trying to see how to mobilize the resources so that for this mechanism has enough resources to address it. And the other issue that the bank is looking for is what will be the relationship between this mechanism and, for instance, the IMF, because Prakash, you know that when it comes to the international architecture, the IMF is the lender as last resort, right? The IMF is the one who actually have the mandate. So what will be the relation to the IMF? There are pro and con. So people who are saying, well, it is important that we coordinate the IMF, or they are saying, well, perhaps we don't need to give the impression that this mechanism will be dictated by the IMF conditionality. And also, what will be the relation with the African Development Bank itself? Should the mechanism be hosted in the African Development Bank or be completely independent from the African Development Bank? Like, for instance, you have the European Stability Mechanism, but we also have there the European Central Bank. So these are the kind of issue that we are discussing. I had the chance to lead the team who is working on it. And we put in place a panel, a high-level advisory panel with very top-notch experts like the former managing director of the IMF, Dominique Strauss-Kahn, Jean-Claude Trichet, José Manuel Barroso, but also some academicians like Joseph Stiglitz himself, the Nobel Prize, and Jeffrey Sachs actually are participating to this. So this is something that will actually come, I think, by the end of this year, early next year, we will have this Africa Financial Stability Mechanism in place. So like what is done in other regions. I had a chance to talk to the ESM staff, European Stability Mechanism. I also talked to the Arab Monetary Fund and the China initially for multilateralization in Asia. So this is what the bank is focusing on. The second agenda the bank is focusing on is, and I'm going to stop here and come back to give more detail in the discussion, it is actually the climate change. Our new report on Africa outlook for the 2022 is on climate change. See, this is a critical issue that the bank is addressing, and we think that it's important in particular because COP27 will be in Egypt, so in Africa, and we are actually mobilizing. There is also a lot of things that we're doing in terms of we've actually started working on the impact of the Ukraine-Russia crisis on, in particular, on food, the risk of food crisis, and the bank is starting already mobilizing the resources in case we have to provide additional budget support and so forth. Let me just stop here. This is actually, I wanted to give a kind of big picture of what the bank is doing, and I can come back to give detail if needed. Thanks.
Thank you, Emmanuel. That was an excellent presentation. Now, should we pause here to see if there's any questions from the audience before we can go on discussing about some of the themes that emerged from our discussion so far? I don't know if Khadija, have you got any questions from the audience? Khadija, did you hear me? Instead of waiting for the audience, maybe I could go on and discuss some of the thinking that I have, combining the presentations that I've heard so far, and then we could maybe discuss among ourselves while waiting for the audience. Is that okay? Is that
yeah, please,
Emmanuel?
Yeah,
okay.
Yeah, please go ahead.
All right. First of all, I think the presentation very much confirmed some of my thinking on the subject. In defense of the international institutions, I think it's important to recognize the special characters of this crisis. This is once in a 100 years event. And given the interconnectedness of the whole world, the impact, of course, has to be very, very severe. It affects all countries alike, but most particularly, it affects the poor, the developing countries more than others. But part of the problem is that this crisis was so new and it created many uncertainties, not just in all over the world, but even in developed countries. For those of us who live in the US or Europe, we know how confusing information was, whether you should wear masks, whether you should not wear masks. Even as recently as last week, Dr. Fauci was making a statement. He wondered if the lockdown actually made any difference. Well, many countries throughout the world have gone through the lockdown. And now if there's a question on the effectiveness of the lockdown, it means, a lot of the measures we were taken was actually taken in the dark. And so, as science developed, there was a lot of unknowns and we had to live with it. Another unintended consequence of this crisis is that the role of the government inadvertently has become much more important. And that's important not just for developing countries because of the fiscal measures they have taken, but also in developed countries. Nobody could talk about, the private sector initiative in dealing with this, with the COVID-19. Yet, as Rim pointed out earlier, when talking about mobilization of resources to fight this COVID, inevitably we have to come back to the private sector to get more resources. So that's one of the perhaps controversial role of the government in this crisis. As Rim has pointed out, the crisis is far from over. For many countries, for many developing countries, this is just the beginning. And I'm afraid that not just because COVID-19 is not likely to go away, but in the next few years, because of the financial and the fiscal situation of these countries, there will be a lot of choices to be made. And this is when the role of the international financial institution will become a lot more important. As Prakash has clearly stated, the IMF has played a very important major role and has in fact gone beyond its call of duty to come out very early in support of countries to fight COVID-19. Unfortunately, I think when one look at the effect of this intervention, precisely because of the uncertainties that I mentioned earlier, there was some gap between what it wants to do and what it has actually achieved. For instance, one of the foremost important measures for countries around the world to take is to get access and to deploy the vaccines needed for COVID-19. And yet, if you look at 2020, the whole entire year, there was not even in the US, not even a vaccine available. All the vaccines started coming out in January of 2021. And of course, by then, the developing countries have no chance whatsoever to have access before the vaccination is done in developed countries. So in terms of effectiveness, on-the-ground effectiveness of helping, I think there's a lot of gap between what the international financial institutions would like to do, even though they came out early in support of the fight, with the reality on the ground. And same thing with the World Bank, same thing with AFDB. Everybody wanted to help. As Emmanuel pointed out, the bank has committed some $157 billion to help countries fight COVID-19. And the African Development Bank has put out $20 billion and another $9 billion facilities. And so did ADB and IADB. But still, the gap is there. The gap between what everybody wants and what's actually realized on the ground is there. On the other issue, and I think this is where international financial institutions can help countries a lot, and that is in the sort of provision of the technical assistance and the advisory role that these institutions can do. Because if you don't have enough financial resources to support them, the advisory role is as important, if not more important, for these developing countries. And there, I think, there's, as Prakash has clearly pointed out, there are two camps. There's one that say that, one need to make government accountable That's fine. I think it's important to have accountability, mainly because the resources spent by countries, by developing countries in particular, ultimately have to come from themselves. So having accountability for the fiscal actions taken is extremely important. At the same time, I think at the individual country level, there's a lack of guidance. There's lack of help from international financial institutions, the way that we've been doing in the past, in order to help them set up what I would call a medium-term expenditure framework, meaning that you clearly chart a fiscal path that even in the short term, that you violate the fiscal solvency, fiscal sustainability in the short and medium term, but in the longer term, at least, you know where you are and how to get back onto a sustainable fiscal path. That, I don't see that been done throughout the last 2 or 3 years, and I think that's important. In particular, for the bank, especially the World Bank and the development of and the regional development banks, there need to be some public expenditure review to help these countries look at the resources available and to make some core program, or maybe select a core program to help protect, especially the poor and the mostly people in the informal sectors, children, women, all of the vulnerable segments of the populations during this crisis. I think that is missing. Going forward on the issue of, as Riem has pointed out, this is only the beginning. Many developing countries still have to buy vaccines and to buy the medication for the treatment of COVID-19. And that, in our calculation, should take at least between 1 to 1.5% of GDP, depending on the resources of the country. But on average, we should take about 1 to 1.5%. And we hope that, with the SDR with the new SDR allocation, this could provide the resources for these countries to use immediately. Finally, on the question of the role of the international institutions, as Prakash has pointed out, the international organizations certainly could leverage their limited resources by combining resources in a country-focused manner, using their comparative advantage position. This leverage, when combined with policy advice, could help many low-income countries. I mentioned earlier that the review of the investment program in preparation for the recovery certainly could help them pay attention to the key policy issues. Finally, let me go back to the question of external debt. Clearly, there's no way that the low-income countries could begin the recovery process without addressing the external debt issue. One of the concerns that everybody has is that if debt defaults are going to rise, and this will have a cascading effect on not just developing countries, but also on the regional development banks, including African Development Bank, ADB, because that would raise the cost of funding to these institutions, and that would cause higher costs ultimately to the developing countries themselves. So one final point is that I think in all of this help, usually financial resources is just one thing, but advice, what I call soft resources, are also very important. These include the collection and dissemination of the pertinent information, digest and disseminate this information to the developing countries, using all the instruments and tools available in the developed countries. I think this helped a lot for the next crisis, which I have the feeling would be international in nature. I don't know if there's any other questions now coming.
Yes, perhaps I wanted to comment, if there is no question, perhaps I wanted to say a few things on the SDR allocation.
Yes, go ahead, please.
If there is no question, I think this is a very important issue. As you know, for the IMF actually allocated into the general allocation, the fourth general allocation of SDR, right, to help member countries, 190 member countries of the IMF, to cope with the crisis. It is true that, of course, SDR are allocated based on quota, right? And of course, advanced country got the lion's share. They got something like 275 billion out of the 650 billion. Developing countries got only 275 billion, right? And Africa got only 33 billion, right? Less than 5% of the total. So from the African Development Bank, what we are saying is the following. First, advanced countries do not need those SDRs. They don't need it. Keep in mind that advanced countries spend 20% of their GDP to tackle the COVID-19 crisis. 20% of GDP of advanced countries is something like 10 trillion US dollars. 10 trillion US dollars. And they spend another 10% of their GDP in loan, guarantees, equity. So they don't need the 275 billion, right? We had a discussion with the US, with the European and so forth. It's clear that how to redirect, how to channel those SDRs that they don't need to Africa has been a major challenge. As Prakash was saying when we were discussing, the IMF created some of the countries already put their SDR in the PRG trust, right? And there is this resilience and sustainability trust that the IMF put in place. So now the issue is the role for African countries. If they don't get those SDR, is becoming difficult for them. It is true that when we look at the institution which are prescribed holder of the SDR, the African Development Bank is a prescribed holder of the SDR, same thing like the BCAO, the BEAC. So we are saying to the international community, well, why don't you guys reallocate those SDR that you don't need to, let's say, the African Development Bank, which is already a prescribed holder of the SDR, so that we can use it to help the country in terms of vaccine, but also in terms even of climate change and so forth. The problem is the following. I was there when there was a discussion between Kristalina Georgieva, the IMF Managing Director, and President Tumin Adegina of the bank. And Kristalina was saying, well, it's possible, but there's some issue there because they are not sure, the IMF is not sure that the reserve asset status of the SDR will be maintained if those SDR are reallocated to Africa. And the Europeans are saying, when we had a discussion with Christine Lagarde, who is actually the European Central Bank, and she said that, unfortunately, Article 123 of the European Central Bank doesn't allow Europe countries to reallocate the SDR because it will be viewed as a monetary financing of fiscal deficit. See that? So basically, now we are kind of stuck. You see, African government is stuck. You see, it means that we will be living just with the 33 billion look, the 33 billion, how is it allocated? A country such as Nigeria got only 3.3 billion. What do you want Nigeria to do with 3.3 billion? Egypt got 2.8 billion. Tunisia 0.7, so 700 million. The same thing for Cote d'Ivoire and so forth. So these are really little money. They're nothing to. I don't think that the crisis of this magnitude could be actually addressed with just 33 billion. That's the major issue we are discussing. And linked to the Africa Financial Stability Mechanism, we even put a proposal on the table to say, well, if there is perhaps no trust to African, perhaps through the Africa Financial Stability Mechanism that we will put in place, perhaps we can use part of those SDR, you see, to really fund the Africa Financial Stability Mechanism, to really have a mandate to address the issue of debt and fiscal risk and financial risk in the continent, as what the European Stability Mechanism actually is doing. Because keep in mind that without the European Stability Mechanism, I'm not sure Greece would have actually recovered from the big crisis. Greece, Portugal, Ireland, Cyprus. We know what happened in 2009, 2010 to those countries. That's the kind of discussion we are having. But unfortunately, I'm not seeing really the international community coming clearly. I had a very good discussion with Dominique Strauss-Kahn and Jean-Claude Trichet on this in the context of the Africa Financial Stability Mechanism. They say, well, this is not a technical issue. This has nothing to do with preserving the reserve asset status of the SDR, because this is what the IMF is putting. And I'm glad Makashi is there. Perhaps he can give more detail from the IMF side. They are saying, well, we are not sure that if we reallocate to Africa, the reserve status of the SDR will be actually maintained. But Joseph Stiglitz even said it, even just Jeff Sachs, he said, no, the major issue is about political will. If there is the political will, it's possible to find a way. See, so this discussion has been ongoing for now something like a year, and we are completely stuck. See, let me just stop here to say that this is actually. Thank you.
Absolutely. Prakash, do you have any?
Yeah, I have some reactions to Emmanuel. Maybe start with him first, but then I would also like to react to your very nice statement here. So on the SDR allocation, I mean, I think what you said at the end is the true constraint. It's the political constraint. I mean, it is sort of not a state secret that among the IMF shareholders, there is a variety of views on the desirability of the allocation itself, on the size of it, on how much of it could be reallocated and so on. So yeah, I think you're right. If there was the political will, a technical solution would be found to move ahead. So you're right, the RST is only the size of that, as far as I know, is only going to be like 50 billion or so. So that will help. You know, it's not nothing, but it's not going to be the major channel for reallocation. It will be a channel. I think it'll be an important channel, but it will not reallocate the full extent that should be possible, given the figures that you described. Let me actually talk a little bit about a point that Hin made, which I think is important, on which I wanted to kind of raise an issue, and then I actually wanted to come back to you also, Emmanuel, on your African Financial Stability Mechanism. Hin, I wanted to take up your point about, the importance of these institutions in playing an advisory role, in addition to the financing. And to me, the kind of advisory role that the IMF played poses a bit of a challenge, because I think the IMF sort of took what was the prevailing consensus view at the time, namely that lockdowns were needed and effective, and that's what countries should do. And as you were saying yourself, now we have Fauci wondering whether the lockdowns were as whether they made a difference. So I think this is a difficult position for an agency like the IMF to be. This is a health emergency. The IMF's ability to, in real time, to make a judgment on whether or not lockdowns were effective, I think was very constrained. There is no expertise within the IMF to reach some conclusions about the effectiveness of lockdowns. And if there is a seeming consensus in the scientific community, as there seemed to be in April, May, June, that lockdowns were needed, and then the IMF goes along. And the reason I emphasize the IMF's forecast errors are you have to wonder whether those forecast errors came from applying basically an advanced country outlook to emerging and developing economies where there is higher informality, where the lockdowns may not have been needed to the same extent, etc. So I think this poses a challenge for the IMFs and any other financial institution to play an advisory role in crises that are not close to their core functions. So, the global financial crisis, the IMF did not anticipate it, but once the crisis had erupted, the IMF was a bit on home turf because the nature of the crisis was one where it had a lot of expertise. But this is a crisis where it does not have expertise. And if future crises are more of these kind of outside non-core financial areas, to me, it raises a challenge of what kind of advisory role the IMF can play. And perhaps the lesson is that the IMF needs to be cautious and really try to explore the full range of views and, be aware of the full range of differences across its member countries in how the crisis might play out. So I think I completely agree with you that in addition to financing, the advisory role is important, but I think this crisis, in my mind, raised a challenge in that respect as well. And if I could, yeah.
No, what I mean, actually, let me clarify. My point is not whether the fund's advice was appropriate. I don't think any country, any international organization was equipped with the proper advice during that kind of crisis that happened once 100 years, once in 100 years. No, what I was thinking is, my feeling is even for organizations like the bank, we're not equipped. But the point is, in terms of the financial policy dealing with it, in terms of the fiscal advice and this whether we shouldn't come out more accommodating to the crisis at hand, and therefore allow, for example, let me be very specific. For example, we know that usually if the debt to GDP ratio of a country gets above 65%, that's when everybody is concerned, that's when the debt sustainability questions arise. But then in this case, whether we should come out and be more frank and be more forthright to developing countries that say, look, if you can get above 70, 75%, but then in 5 years, provided that you can get back to the path that you had planned before, 65, 60%, and that should be okay. I'm not sure. I'm just wondering aloud if some sort of a guidance could come out more clearly in favor of taking big risk to help developing countries. That's more.
Well, I think in the sense the IMF already did that. I think the IMF, the debt sustainability analysis already sort of tried to lean in that direction of giving as much flexibility as possible. But I still think that there is a connection between the ability to assess the health consequences and the effectiveness of interventions and the fiscal policy advice. Mm-hmm. Suppose that in March, April, the IMF had reached the conclusion that lockdowns were essentially not needed in many low-income or developing economies. It could have then it could have been a little, it could have said, look, you don't need that kind of fiscal support. You don't need that spending at the moment, or perhaps even ever. And it could not have created a debt situation to this extent in the first place. So I think I'm just pointing out that the financial aspects are also tied to its ability to assess and reach a judgment on the other things. But I see your point as well, of course.
Yeah.
I don't know if you're out of time or if I can.
No, we have plenty of time. It's only.
Actually, I had lots of questions for Emmanuel. And I think we should also talk offline, because what you're doing is very helpful for my evaluation. Sort of the two questions I had for you. One, actually, Hin brought up also, which is, perhaps we don't need to take these kind of debt to GDP thresholds that we have in mind that seriously. I remember an old paper by Ken Rogoff that said, 40% is the debt intolerance limit for developing countries. And I think that's clearly shown not to be the limit. So you were mentioning 70 is where they are. So I think I agree with him that we need to be a little more flexible given what has happened.
No, Prakash, I fully agree with you. Actually, when I was mentioning the 70% is because many African institutions, regional institutions like ECOWAS, like WAMO, they have this threshold of 70% of GDP. See, as a convergence criteria, it is true that actually, for full disclosure, myself, I'm doing a paper on what would be the, let's say, the correct ratio for African countries. See, there's a paper that I'm actually working on and it will be ready by the end of this year. And also what Hin just said is really critical in terms of being flexible. Even the president of the bank, President Adesina, the idea that Hin just put in the table, he's pushing for the idea for even ADF country, the IDA, let's say the IDA, the World Bank, we call it IDA countries, right? Those fragile states. In the African Development Bank, we call it ADF, Africa Development Fund country, which access the ADF countries. He's saying, well, look, those fragile states are stuck, you see, in a low equilibrium, low growth, widespread poverty, inequality. And we're saying, well, because of the debt issues, there's nothing to do. We just give them some minor. And he's saying, well, perhaps it's time for us to let them also go to the market, see, to get those resources. And today there is a big discussion on how to use the ADF equity, something like 23 billion to actually help ADF go to the market, to what IDA actually does at the World Bank. You see, IDA does that. And we call Carl Peters, he knows him very well, to help us, you see, to think about how we can do so that in terms of the 16 ADF replenishment, well, this issue of helping the fund has more resources and even help the fragile state really access more resources. You see, that's the kind of discussion. And I fully agree with him that we need to be more flexible, because if we just say, well, this is what the debt sustainability analysis is giving, you guys are actually just red, so it's bad for you, there's nothing else you can do, and the rating agencies start downgrading those countries, then we are kind of stuck. I'm not seeing any future for this kind of fragile state, you see. That's why I agree with you that we need to be more flexible when it comes to. I remember when I think I was at the IMF or at the World Bank. I don't recall. I was talking to one of the Minister of Finance, So I think Minister of Finance of Gabon. He told me, but you guys I'm saying, but I'm sorry, you guys are even telling me, well, put money on the side for this stabilization fund. I need money today to build the infrastructure. I don't have the infrastructure. Why you guys are always putting this issue of debt on my head? See? And that's the kind of issue we are facing when we talk to policymakers in real time. Is that the kind of thing they bring on the table?
Should I just spend a minute to raise my other issue, Hen? Or
yes, please.
Yeah. So, Emmanuel, I was very curious about your, the kinds of discussions you had when you were thinking about setting up this African financial stability mechanism. Now, I think that, as you correctly said, the ESM enjoyed some successes, but the Chiang Mai initiative, I think, has never really been used. I don't know much about the Arab Monetary Fund. So I'm wondering whether you could have some of the same issues as Chiang Mai, in the sense that within this mechanism, there's not enough, when you're hit by a shock, most countries may be hit at the same time, so that there isn't really an ability for too much cross insurance within the mechanism. So that I'm wondering if this will actually succeed as a regional insurance mechanism, but perhaps you have broader goals in mind. Maybe I haven't. Maybe I didn't understand what exactly is that you're setting up.
Yeah. Okay. Thank you very much, because I think that's a good question. First of all, as I said, this mechanism exists. Although it is true that in other places in the world, the mechanism sometimes it's a monetary mechanism, right, like the Chiang Mai, right, or a budgetary mechanism, a fiscal mechanism like the ESM, European Stability Mechanism. See, so that also is a kind of difference, see, between the Chiang Mai, for instance, and or even the Arab Monetary Fund. See, and keep in mind that Africa, we already have the African Monetary Fund, which is, by the way, not working, which is kind of monetary mechanism. What we are seeing here is we need to have a fiscal instrument, right? And basically, we are saying, well, this Africa Financial Stability Mechanism will focus not only on crisis resolution, like providing resources to a country which may be facing liquidity issues, in the short-term liquidity issues, but and to prevent that country actually fall from liquidity issue to solvency issue, right? So that it becomes very difficult. But we are also saying that the Africa Financial Stability Mechanism should actually be a mechanism which prevents Africa countries to go into debt from the beginning. This is where early warning system should be put in place, debt sustainability analysis, fiscal risk, see, to really look at, so that, because one of the big mistake, and I'm glad he is here, one of the big mistake actually that African countries made after the HIPIC, the heavily indebted poor countries, and the MDRI, and as I was saying in my introduction, Queen and myself will work to help Niger got to the completion point. That was in 2005. See, when Niger got this debt relief, something like $243 million of debt relief, and the debt to GDP dropped a lot. And if you look at the trend of the debt to GDP ratio in Africa, in 2009, 2010, it's about 30%, which is good. But now it's about 70%. It increased a lot since 2010. And plus, it's not just, it also the structure, which is really worrisome. That's why we are saying, well, this mechanism should really prevent this thing to occur. I mean, giving, for instance, a platform to discuss with the country clearly and openly that, well, you guys are, and I think the African Development Bank is better placed, and I'm sorry to say that, hey, Prakash, the African Development Bank is better placed than the World Bank and the IMF to talk with policymakers, because you see, I got a chance in my career to work for the IMF, the staff of the IMF. Even I was at some point, even the senior advisor to the executive director, right? And the World Bank with him. And when I came to the African Development Bank, I thought that actually African policymakers, they respect the World Bank and the IMF, but they trust the African Development Bank. That's what I thought. That is something I learned. When African Development Bank go there, talk to them, because they are among themselves. was the president that was the president. We were saying him, look, if you put this thing in place, you talk to the policy maker, African head of state, Minister of Finance, Minister of Budget, to say this thing is really serious. We need to take seriously. We should not continue counting on the international community to give you debt relief. You see, I remember when I was at the IMF board, the US, they say clearly, well, you know what? We will never give you another repeat, the MDR, never. And they didn't know. You see, that was the DSSI, the common framework. That's the problem that we are having. Right? Because Africans were expecting, well, it's still, are we going to get the repeat? No way. I was there. So that's something we do. And the good news is that the African Union just endorsed the African Financial Stability Mechanism to tell you how even Africans, they are not themselves concerned, saying, well, we keep on asking money to the international community, reduce our debt, but we should, first of all, put our country in order, our house in order. That's exactly what the African Financial Stability Mechanism will be doing, you see, to give that platform where even negotiating the debt with the Paris Club, non-Paris Club, and so forth, see. But now the big issue is the commercial debt, you see, in particular for private sector. How are we going to deal with that? That's still an issue that we're discussing, because as I said, something like 13% of African debt is owed to China. And the Chinese doesn't want to talk about it. See, they don't. The common framework actually failed because they don't want to hear about this common framework, even the DSSI, because they know that most of that is owed to them. So that's why the African Financial Stability Mechanism are offering this platform, you see, to orderly debt resolution, but also preventing the debt to occur is for me a mechanism. And again, I'm glad that really the African Union actually endorsed the project, and it's no longer African Bank project, it's now the African Union. And myself, what I'm doing in the bank, African Bank, is to talk to the president to say, well, we need to take these things seriously, because we always look like, well, we start going, we use a pro-cyclical fiscal policy, and then we spend, and then we are in debt, and we are expecting the international community to release on it. This is not good.
Yeah, no, thanks for describing that. That seems like a broader and quite a different initiative than a small regional insurance scheme. Thank you.
Well, with that, I mean, if there's no any other issues, perhaps first I'd like to thank Prakash and Emmanuel for the very useful and exciting exchange of views. Let's hope to do it again soon. And again, thank you.
Okay.
If there's anything I missed, please forgive me and let me know. Thank you, Prakash. Thank you, Emmanuel.
Thank you very much, Finn. Thank you. Very good insight. Thank you, Prakash. We keep in touch.
Absolutely, yes.
Yeah, I will need your help.
Prakash, we're in Washington, so whenever you want to talk,
I didn't realize you were in Washington. Let's get together then.
Right.
But I'm in Côte d'Ivoire.
But Emmanuel, you come here sometimes.
Well,
right?
I'm going to come. Actually, I was supposed to come for the spring meeting. The spring meeting will be now virtual, so hopefully by the annual meeting.